Recent evidence suggests that one section of the population is not accessing the fire safety help that's available to them free of charge. The people we're talking about here are those who suffer from mental health issues that can take on many forms. Memory loss in older people, psychosis, anxiety, or any other of the wide range of mental health problems affecting people here in Wales.
Well, people with mental health issues often they take medications which can make them quite sleepy, so the risks of accident or even death is quite high.
This is a section of the population that we as firefighters only come across if there's something gone wrong or if there's been a fire.
The Welsh Government is committed to reducing the number of fire incidents in this sector of the population and has funded an innovative partnership project. As a part of this project, a specialist mental health worker from Hywel Health Board has been seconded to Mid and West Wales Fire and Rescue Service. The aim is to ensure that the homes of patients are as safe as possible using the Home Fire Safety Check.
Research proves that people who received a home fire safety check in the last year and with a working smoke alarm are less likely to die in a fire.
Normally, the safety check would be carried out by the fire service, but after special training developed in cooperation between the Health Board and the fire service, the home fire safety check can be carried out by care staff such as community mental health nurses, social workers, occupational therapists and support care staff.
I think the carers are in the best position to carry out a risk assessment of the individual and of their property, and therefore highlight any hazards and pass on any relevant information to the fire service.
Mid and West Wales Fire and Rescue Service and Hywel Health Board are committed to reducing the risk of death and injury by fire. By incorporating a home fire safety check into a patient's care plan, we are determined to reduce the incidence of death and injury suffered by this vulnerable group.
It's not only about avoiding death and injury, but also fire and smoke damage. Losing a home for even a short period can cause great anxiety. Even a small fire would be a traumatic experience for most of us, but for elderly people or those experiencing mental health issues, it can be catastrophic. It's a well-known fact that even after a small fire, many elderly people never return to their homes and therefore lose their independence forever on the actual plug itself, as long as they don't.
The training course was with experienced firefighters. It was excellent, really. It taught me a lot about safety myself. Once I passed the assessment, it didn't end there because they keep supporting you. They're very supportive. If there was any difficult situations, you could always ring them up and ask them. If a complex case comes up, I can always ring my mentor, speak to him about it, discuss the situation with him, and we can arrange perhaps a joint visit to the service user's home, which is supporting both the service user and myself.
But if it wasn't for the home fire safety check, I would still be in ignorance, and well, the community mental health team haven't been trained up to do this sort of work in the past, and I feel that it should be something in the care plan that is needed. It's
made me realise that fire is a killer. I learnt a lot myself with regards to my own home, and also the fact that I didn't realise that fires could actually spread so quickly.
If it wasn't for Delith coming today, I wouldn't have been aware of the risks. Well, I got a problem leaving people into the house, and with Delith comes regular. I know Delith, and I don't like people going from room to room. But it was natural with Delith because, you know, she helps me out, and if someone else had come in, I feel I'd be reluctant to show them the house or even to discuss the matters. And Delith has taken it step by step over a few visits, and she's shown me quite a few of the hazards. Well, it's like going out through the back door. I've cluttered the back door up because I don't go out in the garden in the winter. But then if I wanted to get out there would be no way for me to get out in the dark. And it has opened my eyes to some things need to be changed for safety reasons.
To help us understand the problems they face, all our firefighters are being trained in mental health first aid.
I think it's a very good idea that the firefighters are doing the mental health first aid course. This is something which should have been done previously. It's a good initiative, and I feel they got an understanding then of the issues which people with emotional health problems have.
This project is only just rolling out, but in future, home fire safety checks will become an integral part of every mental health care plan, and to avoid more paperwork, state-of-the-art technology will be used. A netbook-type tablet computer will be issued to every practitioner trained in home fire safety checks. The safety check document will be filled out on the computer and then sent directly to the fire service, where it's stored on the fire service computer system, from where it can be called up as valuable information during a 999 call.
Should one of my patients call 999 due to a fire, automatically, when the call goes through, it actually registers the information that we've actually registered is stored, actually will automatically go to the fire engine. So the firefighters know, for example, if it's Joe Bloggs, maybe he sleeps in the back bedroom on the first floor of the house and he suffers from agoraphobia, say. So this information could be critically important because at the end of the day, due to that information, lives can be saved, and it can only serve to be a positive for both the trust and for the fire service, because of that information, and the joint working has actually saved a life.
I feel that I am very fortunate to be part of this home fire safety check. It's a good pilot, and hopefully the pilot will be extended throughout Wales.
The pilot project has already been proven a success in Pembrokeshire, but the sooner it is introduced to the rest of Wales, the better. The work done here is very effective and helps reassure the minds of the most vulnerable members of our communities. But more importantly, it saves lives.